My name is Dr. Andy Tao. I am a gastroenterologist at Austin Gastroenterology. This month of March is Colon Cancer Awareness Month. I want to discuss with you today the importance of getting colon cancer screening. We have made progress. Due to increased awareness and subsequent screening, since the mid-1980s, the colon cancer survival rate has been increasing. By finding polyps and cancer in the earlier stages, it is easier to treat. Improved treatment options have also contributed to a rise in survival rates. Nevertheless, colon cancer remains the second leading cause of cancer-related deaths in the U.S. It is projected to be the number one leading cause of cancer-related death in those under the age of 50 within the next decade. However, colon cancer is unlike almost all other cancers in that it can be prevented by a procedure called a colonoscopy. Approximately 1 in 20 Americans will be diagnosed with colon cancer in their lifetime. It affects men and women equally. Most cases have no symptoms until the disease is advanced. Therefore, waiting for the onset of symptoms to act is a mistake. This principle is true for all cancers, which are almost all universally painless in early stages. Why is screening for colon cancer essential? This is because colon cancer takes a long time to develop. It grows silently over 10-15 years in the form of a precancerous polyp. Removing these with a colonoscopy will prevent the colon cancer entirely. Early detection of colon cancer is also useful because if found, early-stage colon cancer is associated with survival rates over 90%. Screening can prevent colon cancer before it starts by removing precancerous polyps. Develop. It grows silently over 10-15 years in the form of a precancerous stage. Removing these with a colonoscopy will prevent the colon cancer entirely. Early detection of colon cancer is also useful because if found, early-stage colon cancer is associated with survival rates over 90%. Screening can prevent colon cancer before it starts by removing precancerous polyps. There are two types of screening options. Colonoscopy is the gold standard because once again it prevents cancer by removing precancerous polyps. The other option are non-invasive stool-based tests, which detect cancer in some polyps but do not prevent it. One stool test is called the FIT test, or fecal immunochemical test, which looks for blood in the stool. The other test is called a Cologuard, which detects DNA changes in stool samples and blood in stool. During a colonoscopy, a doctor examines the colon using a flexible camera. The purpose is to look for precancerous polyps, which are then removed during the procedure, stopping cancer before it develops. Again, no other screening test can do this. A polyp is a small clump of cells on the lining of the colon. Most colon polyps are harmless. Some colon polyps can develop into colorectal cancer, often fatal when found in its later stages. Not all polyps turn into cancer, but all cancers start as polyps. There are two main types of polyps. Hyperplastic polyps are harmless and have no cancer risk. Adenomas are precancerous polyps which must be removed. Because colon polyps do not usually cause symptoms, it is important to have regular colorectal screenings such as colonoscopy. Depending on the size, number, and type of polyps you had, the doctor will give instructions on when you should return for the next colonoscopy. So who needs to get screened? Everyone 45 years old and older needs screening. These are newer guidelines which lowered the screening age from age 50 to age 45. People with a family history of colon cancer should start earlier. Anyone with symptoms like blood in stool, unexplained weight loss, changes in bowel habits, or stool caliber also need a colonoscopy. Also, people with inflammatory bowel disease like Crohn's or ulcerative colitis need screening colonoscopy every 1 or 2 years. After you complete your colonoscopy, your doctor will instruct you when to come back for your next one. If no polyps are found, repeat in 10 years. If 1 or 2 small polyps are found, repeat in 5 to 7 years. If 3+ polyps or large polyps greater than 1 centimeter, repeat in 3 years or sooner. High-risk patients with strong family history or genetic conditions may need more frequent screening. What should you expect with a colonoscopy? First, it is a safe procedure with millions being performed per year. While there are risks like bleeding and perforation, they are exceedingly rare. Sedation given during the procedures ensures you will not feel pain or discomfort. The day before the procedure, you must fast and only drink clear liquids. The night before the procedure, you think a laxative preparation. The laxative preparations is not as bad as you think. They have improved in terms of taste and volume over the years to be much more tolerable. One alarming trend that has been noted in the last 15 years is that young adults are being diagnosed with colon cancer at high rates than ever before. These cancers in young people tend to be more aggressive. Many cases go undiagnosed for some time due to lack of screening in younger people because of a false sense of security. The bottom line is that colon cancer is preventable in so many people because colonoscopy can remove the slow-growing precancerous polyps. Take action today. Get screened, spread awareness, and prevent colon cancer. Thanks for your attention.